What's your take, doctor, then on this whole concept? There's so much of conflict around total cholesterol versus your ratio of your triglycerides and HDL, where if your ratio of triglycerides and HDL is excellent, your LDL is found to be higher in certain people who are active, and it's completely not taken as a cholesterol issue. You know, again, stress test was done, 2D echo and all of that stuff. These are becoming norms where people are saying you don't have to be medicated on a total cholesterol if your ratios of tris and even if the LDL is on the higher side. What's your
See,
take? Because there's so much of mixed
yes, so
information around
there
this.
is a lot of information. It's all
Yeah.
confusing, but I look at
Yeah.
only few factors. One is if the LDL is to be taken along with other data. Look at your triglyceride, your family history, your diabetes, your atherosclerotic, or you already had a disease, or your CT coronary showing something. Even if your LDL is 110, which is normal, but if you are developing blocks in your heart circulation, I will not accept LDL.
Yeah,
I'll
absolutely.
bring it down to 50, 60.
Absolutely. Yeah.
But if your LDL is say 135, 140, which is a gray zone, but if you are clean and say no family history, nothing, then I'll probably hold it back. But to expect that diet will change the LDL is a myth.
Yeah.
It will not happen. Triglyceride, yes, we can
Yes,
work
yeah.
on it. But again, which LDL? Most lab, 99% of the labs will not give you small LDL value. So there are two types of LDL.
Yeah.
Small dense LDL and normal LDL. Now no lab measures small dense LDL. So if your LDL is say 120 and the small LDL fraction is 60% of it, it's a very unhealthy LDL because this small LDL fraction is the one which causes atheroma, blockage. Nobody measures it. You have to lab this to do it separately. There are only one lab or two labs which are doing it here, or even my hospital doesn't do it unless you specifically request for it. So if you want to do a lipid profile, if you bank on LDL, then you need to know your small dense LDL fraction. You need to know your LPA. Now lipoprotein A is hardly measured. It is 6 times more atherogenic than LDL, and LPA is genetic. It has to be taken into account. So if your LDL level is high and LPA level is high, I have to treat your LDL because I have nothing to treat your LPA.
Yeah.
Other than try to manipulate diet and see whether I can fall. I have some patients who LPA has fallen with diet. I don't know how, but it has fallen.
And the lipo, if that is decent and the LDL is still slightly on the higher side, you're okay with that?
I'm all right with that. I don't
Again,
chase LDL
yeah.
too much if there are, it is not
Understood.
creating. Otherwise,
Yeah.
you end up giving statin to so many people.
Yeah, exactly. Because most people will fall in the category of a
Not
statin.
worth it. I'd probably make them run and get them to some intermittent fasting and get them triglyceride to 65 and bring them SDL and live with it.
Nice. You believe in fasting as well, doctor?
Of course. How will you control your insulin?
Exactly. The only way is to keep gaps between meals.
Right? It should be made mandatory.
Yeah.
Sorry.
Absolutely. No, but you're right.
It should be
Because this
mandatory
can
for
solve
us.
so many problems and it's part of our culture.
Yeah,
It's part
it
of
has-
every
it has
religion,
been.
spiritual part to
Yeah,
fast,
it has
right?
been.
I think there's just too much of food available and so
It has
easily available.
That's what,
So-
there was a more because there's something called as, two examples, there's something called thrifty gene hypothesis. Now, thrifty gene hypothesis is what they try to explain why South Asia is getting so many cardiac issues, metabolic issues, why Indians who go to West do worse. Not Indians, South Asians. So the important thing they said that this subcontinent has gone with so many phases of undernutrition, starvation, that we are genetically tuned to live with very low storage. We never stored because we didn't have enough to store it. There was no concept of fat stored in your abdomen or liver because there was not enough food.
Yeah.
So the body is tuned to it. Insulin levels were kept lower all the time. Now, suddenly in 100 years, the transformation happened so acute that there is surplus of food. And that thrifty gene is the one which is probably coding for it. Wow. That's one thing I tell a lot of patients. Second is I give an example of a country called Nauru. Nauru is a Pacific island, one of the countries off the coast of Australia. Very natural life till I think mid 1850, so 1560. Fishermen, community, hunters, farming. That's all they did. Nothing else. No diseases except accidents or age related. Then somebody discovered phosphate, and which is part of your fertilizer industry, and then got of course invaded by the Western world.
Yeah.
They gave royalty to the people. that. And Nauru had per capita one of the richest country they became because they got so much money as royalty. I said, forget why work? They sat back and everything entered into the system. The food habit changed, exercise stopped, fishing stopped. It took only 30 years for the 50% of the population became diabetic, 30% kidney diseases, and the life expectancy started dropping dramatically down. So that's what they coined a term that day. I don't know whether I'm liable for that term, but there's a term called as Coca-Cola-ization of the country. That's the term they used that time. So that is what happened. So imagine one small community in 40 years changed because of one mistake or one error. We are no different.
Yeah.
We are no different. 50 years, 60 years, things have changed. So I'll tell a lot of patients of mine that go back, ask your grandfather or grandmother, and if you're lucky, your great-grandfather, grandmother, what did they eat and how much they ate, and just follow them. Don't come to me asking for what should I eat and what should
that's
not.
true.
Just go, whatever they eat, whatever they ate all their life, even if it's ghee or whatever, use that. But that's where the answer is.
Yeah. I'm gathering from all of your information and your experience and knowledge, doctor, that obviously diet plays a role. And I think I like what you spoke about moderation and exercise and diet, because even we had a beautiful podcast with Dan Butner, who studied the blue zones. And his data comes from the longest living people.
Yeah.
None of them are extreme exercise people. None of them are extreme diet people. Everything. They have a slower life. They have community. They have happiness. Everything you spoke about. Quality of food, of course, is better in certain areas in the world. But you're so right about this. So we're just putting a burden on the heart when we do things out of balance. Heart, kidney, body, and everything else.